Pharmacists. When you think of what they do for a living, what do you imagine? Counting pills? Typing at a computer? Or maybe you're not sure. Well, don't be afraid to admit it. For many of us, their job is just about as mysterious as it was when our grandparents were young. Just remember this: a pharmacist is a healthcare specialist. They're an important member of our healthcare team. They're here to answer our questions and to promote wellness. The pharmacist is a medication expert, the one who thoroughly understands drugs and the way they affect us. This includes prescriptions and over-the-counter medications, including herbal remedies. As for counting pills, while it's important, chances are it's the pharmacy technician doing that. They also gather information to create and maintain a patient's confidential profile. If you're a healthcare professional, the pharmacist is your partner. They provide drug information and advice, emphasizing prevention to keep more of your patients healthy. When your patient is sick, the pharmacist is your medication specialist, providing you with important information about drugs you prescribe. They can work with you to choose appropriate therapy, helping you manage your caseload, especially those patients with chronic disease. After you meet with your patient, their pharmacist ensures continuity of care. They make certain that the patient receives the therapy you intend without conflicting with other drugs they may be taking and that you may be unaware of. And they train your patient on the proper use of a broad range of medical devices, such as blood glucose monitors and peak flow meters. If you work for the government or provide group plan insurance, the pharmacist is like a member of your organization, saving you crucial healthcare dollars. They promote wellness by educating patients one-on-one and on a larger scale in classrooms and in the community. A pharmacist contributes directly to the patient's overall health, often staving off trips to the doctor and the hospital. This lowers insurance claims and conserves resources. They regularly help patients by intervening with insurance companies regarding coverage and reimbursement through their plan. Did you know that pharmacists work in hospitals too? Many of us don't think about this, but without them, essential services such as chemotherapy and dialysis would not be possible. A recent American Medical Association study revealed that when a pharmacist accompanied doctors and nurses on daily hospital rounds, there was a 78% reduction in adverse drug events. As our population ages, we rely on medication more than we used to. While medication has contributed to longer life and an enhanced quality of life, we now know that seniors can go through an average of 25 prescriptions per year. As our population ages, we rely on medication more than we used to. We need more pharmacists more often. As the expert in the field, the pharmacist is the medication manager. The pharmacist plays a fundamental role in our well-being, and it's important that we cultivate a relationship with them. We can go to them first when we're feeling sick or for advice on possible side effects. Pharmacists enjoy talking with their clients, and based on many national surveys, Canadians trust their pharmacists more than any other healthcare professional. They're easily accessible, and aside from treating symptoms, they can help us recognize problems that we should tell our doctor about. Our pharmacist keeps an extra eye on our healthcare. By managing our patient profile on their computer database, they keep track of other medications we may be taking and can alert us to potential conflicts. That's why it's best to choose one pharmacy and then to stay with it. We should let our pharmacist get to know us so they are able to give us better advice. We all know that drugs can be both helpful and harmful. Your pharmacist has had to complete many years of comprehensive university study in order to allow you to get the greatest benefits from your drug therapy. In order to maintain their license to practice, your pharmacist also has to demonstrate that they've continued their education in their field every year. Your pharmacist truly is the medication expert. Regardless of who we are, the pharmacist is a crucial part of our healthcare team. They're on the front line, easily accessible, and ready to help us. Talk with your pharmacist, your medication manager, because no one knows medications better. Now, review this CD to learn more.